Dr. Sage here, back to finish our lecture series on the integumentary system. Today we're going to discuss diseases, disorders, and injuries of the integumentary system. By the end of this video, you should be able to describe several different diseases and disorders of the skin, and describe the effect of injury to the skin and the process of healing. The integumentary system is susceptible to a variety of diseases, disorders, and injuries. These range from annoying but relatively benign bacterial or fungal infections that are characterized as disorders to skin cancer and severe burns, which can be fatal. In this lecture, you will learn several of the most common skin conditions. One of the most talked about diseases is skin cancer. Cancer is a broad term that describes diseases caused by abnormal cells in the body dividing uncontrollably. Most cancers are identified by the organ or tissue in which the cancer originates. One common form of cancer is skin cancer. The Skin Cancer Foundation reports that 1 in 5 Americans will experience some type of skin cancer in their lifetime. Overexposure to UV radiation from sunlight damages DNA, which can lead to the formation of cancerous lesions. Although melanin offers some protection against DNA damage from the sun, often it is not enough. The fact that cancers can also occur on areas of the body that are normally not exposed to UV radiation suggests that there are additional factors that can lead to cancerous lesions. In general, cancers result from an accumulation of DNA mutations. These mutations can result in cell populations that do not die when they should, and uncontrolled cell proliferation that leads to tumors. Although many tumors are benign or harmless, some produce cells that can mobilize and establish tumors in other organs of the body. This process is referred to as metastasis. Basal cell carcinoma is a form of cancer that affects the mitotically active stem cells in the stratum basal of the epidermis. It is the most common of all cancers that occur in the United States and is frequently found on the head, neck, arms, and back, which are areas that are most susceptible to long-term sun exposure. Although UV rays are the main culprit, exposure to other agents such as radiation and arsenic can also lead to this type of cancer. Wounds on the skin due to open sores, tattoos, burns, etc. may be predisposing factors as well. Basal cell carcinomas start in the stratum basal and usually spread along this boundary. At some point they begin to grow towards the surface and become an uneven patch, bump, growth, or scar on the skin's surface. Like most cancers, basal cell carcinomas respond best to treatment when caught early. Treatment options include surgery, freezing, and topical ointments. Squamous cell carcinoma is a cancer that affects the keratinocytes of the stratum spinosum and presents as lesions commonly found on the scalp, ears, and hands. It is the second most common skin cancer. The American Cancer Society reports that 2 in 10 skin cancers are squamous cell carcinomas, and it is more aggressive than basal cell carcinoma. If not removed, these carcinomas can metastasize. Surgery and radiation are used to cure squamous cell carcinoma. A melanoma is a cancer characterized by the uncontrolled growth of melanocytes, the pigment-producing cells in the epidermis. Typically, a melanoma develops from a mole. It is the most fatal of all skin cancers, as it is highly metastatic and can be difficult to detect before it is spread to other organs. Melanomas usually appear as asymmetrical brown and black patches with uneven borders and a raised surface. Treatment typically involves surgical excision and immunotherapy. Doctors often give their patients the following ABCDE mnemonic to help with the diagnosis of early-stage melanoma. A is symmetry. The two sides are not symmetrical. B, borders. The edges are irregular in shape. C, color. The color is varied shades of brown or black. D, diameter. It is larger than 6 millimeters or a quarter inch. E, evolving. Its shape has changed. Some specialists cite the following additional signs for the most serious form, nodular melanoma. Elevated is raised on the skin's surface. Firm, it feels hard to the touch. Growing, it is getting larger. 2 common skin disorders are eczema and acne. Eczema is an inflammatory condition and occurs in individuals of all ages. Acne involves the clogging of pores, which can lead to infection and inflammation, and is often seen in adolescents. Other disorders not discussed here include dermatitis, psoriasis, cold sores, impetigo, scabies, hives, and warts. Eczema is an allergic reaction that manifests as dry, itchy patches of skin that resemble rashes. It may be accompanied by swelling of the skin, flaking, and in severe cases, bleeding. Symptoms are usually managed with moisturizers, corticosteroid creams, and immunosuppressants. Acne is a skin disturbance. It typically occurs on areas of the skin that are rich in sebaceous glands, which would be the face and back. It is most common along with the onset of puberty due to associated hormonal changes, but can also occur in infants and continue into adulthood. Hormones such as androgens stimulate the release of sebum, and overproduction and accumulation of sebum along with keratin can block hair follicles. Acne results from infection by acne-causing bacteria, which can lead to redness and potential scarring due to the natural wound healing process. Because the skin is the part of our bodies that meets the world most directly, it is especially vulnerable to injury. Injuries include burns and wounds, as well as scars and calluses. They can be caused by sharp objects, heat, or excessive pressure or friction to the skin. Skin injuries set off a healing process that occurs in several overlapping stages. The first step to repairing damaged skin is the formation of a blood clot that helps stop the flow of blood and scabs over with time. Before the basal stem cells of the stratum basal can recreate the epidermis, fibroblasts mobilize and divide rapidly to repair the damaged tissue by collagen deposition, forming granulation tissue. Blood capillaries follow the fibroblasts and help increase blood circulation and oxygen supply to the area. Immune cells, such as macrophages, roam the area and engulf any foreign matter to reduce the chance of infection. A burn results when the skin is damaged by intense heat, radiation, electricity, or chemicals. The damage results in the death of skin cells, which can lead to massive loss of fluid. Dehydration, electrolyte imbalance, and renal and circulatory failure follow, which can be fatal. Burn patients are treated with intravenous fluids to offset dehydration, as well as intravenous nutrients that enable the body to repair tissues and replace lost proteins. Another serious threat to the lives of burn patients is infection. Burned skin is extremely susceptible to bacteria and other pathogens, due to the loss of protection by intact layers of skin. Burns are sometimes measured in terms of the size of the total surface area affected. This is referred to as the rule of nines, which associates specific anatomical areas with the percentage that is a factor of 9. Burns are also classified by the degree of their severity. A first-degree burn is a superficial burn that affects only the epidermis. Although the skin may be painful and swollen, these burns typically heal on their own within a few days. Mild sunburn fits into the category of a first-degree burn. A second-degree burn goes deeper and affects both the epidermis and a portion of the dermis. These burns result in swelling and a painful blistering of the skin. It is important to keep the burn site clean and sterile to prevent infection. If this is done, the burn will heal within several weeks. A third-degree burn fully extends into the epidermis and dermis, destroying the tissue and affecting the nerve endings and sensory function. These are serious burns that may appear white, red, or black. They require medical attention and will heal slowly without it. A fourth-degree burn is even more severe, affecting the underlying muscle and bone. Oddly, third and fourth degree burns are usually not as painful because the nerve endings and cells are damaged. Full thickness burns cannot be repaired by the body because the local tissues used for repair are damaged and require excision, or amputation in severe cases, followed by grafting of the skin from an unaffected part of the body, or from skin grown in tissue culture for grafting purposes. Most cuts or wounds, with the exception of ones that only scratch the surface, the epidermis, lead to scar formation. A scar is collagen-rich skin formed after the process of wound healing that differs from normal skin. Scarring occurs in cases in which there is repair of skin damage, but the skin fails to regenerate the original skin structure. Fibroblasts generate scar tissue in the form of collagen, which does not result in regeneration of the typical cellular structure of skin. Instead, the tissue is fibrous in nature and does not allow for the regeneration of accessory structures, such as hair follicles, sweat glands, and sebaceous glands. Sometimes there is an overproduction of scar tissue because the process of collagen formation does not stop when the wound is healed. This results in the formation of a raised or hypertrophic scar called a keloid. In contrast, scars that result from acne and chickenpox have a sunken appearance and are called atrophic scars. Scarring of the skin after wound healing is a natural process and does not need to be treated further. Application of mineral oil and lotions may reduce the formation of scar tissue. However, modern cosmetic procedures such as dermabrasion, laser treatments, and filler injections have been invented as remedies for severe scarring. All of these procedures try to reorganize the structure of the epidermis and underlying collagen tissue to make it look more natural. Skin and its underlying tissue can be affected by excessive pressure. One example of this is called a bed sore. Bed sores are caused by a constant, long-term, unrelieved pressure on certain body parts that are bony, reducing blood flow to the area and leading to necrosis or tissue death. Bed sores are most common in elderly patients who have debilitating conditions that cause them to be immobile. Most hospitals and long-term care facilities have the practice of turning the patients every few hours to prevent the incidence of bed sores. If left untreated by removal of necrotized tissue, bed sores can be fatal if they become infected. The skin can also be affected by pressure associated with rapid growth. A stretch mark results when the dermis is stretched beyond its limits of elasticity, as the skin stretches to accommodate the excess pressure. Stretch marks usually accompany rapid weight gain during puberty and pregnancy. They initially have a reddish hue, but lighten over time. Other than for cosmetic reasons, treatment of stretch marks is not required. They occur most commonly over the hips and abdomen. When you wear shoes that do not fit well and are a constant source of abrasion on your toes, you tend to form a callus at the point of contact. This occurs because the basal stem cells in the stratum basal are triggered to divide more often to increase the thickness of the skin at the point of abrasion to protect the rest of the body from further damage. This is an example of a minor or local injury, and the skin manages to react and treat the problem independently of the rest of the body. Calluses can also form on your fingertips if they are subject to constant mechanical stress, such as long periods of writing, playing string instruments, or video games. A corn is a specialized form of callus. Corns form from abrasions on the skin that result from an elliptical type motion. This has been your overview on diseases, disorders, and injuries of the integumentary system, and this concludes our video series on the integumentary system. Until next time, this has been Dr. Safe.